Hi, friends. My name is Cynthia, and I'm coming to you from New Jersey. I'm a licensed professional counselor, a counselor educator. I have a practice here in New Jersey where I provide intersex counseling, coaching, and consulting. I'm an intersex ally, and my professional mission for several years now has been to increase the quantity and quality of counselors trained to affirm intersex individuals. Please feel free to send me comments or questions to my email. Love to hear from you. And I'm going to go in a clip because there's a lot to cover. But before I get into the 8 topics I want to talk about, I wanted to give you a little bit of perspective into my lens as a counselor onto to the subject of intersex counseling. So we support client goals. And part of that is developing in the client self-worth and self-agency so they can pursue their goals. And we've learned that a lot of times this involves reversing negative social messages. Um, I want you to consider, as we go forward today, the harmful social message of heteronormativity. Every activist, by the way, from my PhD dissertation, I interviewed activists under the belief that activists have much to tell us about developing an empowered intersex identity. And every single one of the activists that I interviewed described having to reverse the social messages of heteronormativity before they develop their empowered identity. I want to give you a picture into a scenario. Now, imagine that in a day in a counseling office, two MRKH, so MRKH is a VHS, one of the variations in sex development. One MRKH woman comes in and says, I'm not intersex, I'm a woman, and I have a defect. The other MRKH person comes in and says, I'm an intersex woman and I don't have a defect. It's just a simple natural variation that I have. Counselors need to be able to affirm both individuals. So counselors need to understand the complexity of information, the complexity of identities that comes under the intersex umbrella. However, counselors are not value free. We're under the guide of the American Counseling Association Code of Ethics. And in particular, the principle of autonomy, I believe, requires me to take a stand against optional sex related surgeries for intersex infants and youth. To give you a sense of the kinds of questions I might hear, I kind of put them into two major categories. Who am I? And how do I manage being intersex? Um, so I'm going to only read one under each category in the interest of time. So under who am I, you might hear, my parents told me I'm fixed as a male or female, but I don't feel that way. I don't feel male or female. In terms of managing intersex, disclosure is a big issue. And so a lot of time might be spent in session on to whom do I disclose, how much, and when. And this can be school, family, relatives, and partnering relationships. This training comes with the assumption that there's a benefit of developing training programs for lay audiences. I've highlighted adult and adolescent intersex because the needs for intersex individuals themselves to educate about their bodies and to learn how to fight stigma is lifelong or can be lifelong. And so there's a need for training for intersex individuals themselves. So we're going to look at 8 topics that I believe are important for an informed intersex training. Number one, there are 2 definitions, narrow, which focuses on the physical, and we can think of broad, which adds personhood to it. Number two, intersex as compared to male and female is actually a sex development path, a physical sex development path. There are over 40 types. And let me tell you a little bit about the names. Sometimes the names are the founder or the researcher who discovered a syndrome of traits, such as Turner's, Klinefelter's. Sometimes the name is actually naming the cause, such as androgen insensitivity. Other times it's the name will be maybe a trait, and for example, micropenis or hypospadias. Because under the umbrella of intersex, the 40 different variations are so different in terms of their physical manifestations and the lifelong health issues. the intersex community is very diverse in terms of their social experiences. So I think it's important to make clear that when we talk the word intersex, we're not talking about one physical trait, set of physical development. We're not talking about one monolithic viewpoint at all. Heteronormativity is a stigma. Heteronormativity is the philosophy about human sexuality in which male men are supposed to desire women and female women are supposed to desire men, and nothing else is appropriate. And that, of course, adds stigma to the intersex individual because their bodies are not male or female, they're intersex. So, for at least physical reasons, intersex individuals are subject to heteronormative stigma. But they can also be subject to the stigma for gender or for a partner preference as well. In my research, I discovered a particularly heinous form of heteronormative stigma, which I call intersex non-existence. So intersex people are told that they don't exist as persons, that they are a defect of male or female. And then medical erasure occurs to enforce that. Seven, I believe it's important to look at leaders who are succeeding in the community, and activists, I believe, serve as a very positive role model for intersex identity. Much to learn. And number eight, intersex people have existed since antiquity. And so it's important to realize that the personhood is here, present, historical, and much to learn. Turning more specifically, definitions, narrow physical, broad includes personhood, all things that go into human personhood. Here's a sample narrow definition, which focuses on the physical. Typically, the white letters are what you hear. I added the yellow because I think it's what should be added to a narrow definition, but really it's the white letters that you hear typically for the narrow definition. Intersex, sometimes called VSC, DSD, consists of one or more congenital differences in sex development traits from what is commonly expected of male or female. These changes occur during the long human sex development path that begins at conception and culminates at puberty. The changes appear in chromosomes or genes, hormones, gonads, and internal or external genitalia. Intersex traits impact the growth and health of the whole body throughout an individual's lifespan. I think this is important because it's important to realize that just because you remove gonads or do other cosmetically altering surgeries on intersex infant doesn't mean that the metabolism that was developed during the long sex development path can ever be taken out of an intersex body. Intersex definitions, the narrow one, are frequently heard in academia, particularly in medicine. You'll hear the terms variations in sex characteristics or disorders or differences of sex development. There are benefits of focusing narrowly on each individual intersex variation because the health needs of the different variations can be so different. And so research based upon the health needs of CAH, for example, makes sense to focus on that, and it will be distinct from the health needs of, say, Klinefelters. But there's a disadvantage in that the narrow definitions have been used as a springboard to see intersex as a defect and therefore use surgical and hormonal treatments to erase. You should know that intersex terminology is very controversial because viewpoints are very different. Those of us who are opposed to the optional sex-related surgeries on intersex infants do not like the pathologizing term DSD. We prefer positive terms. You should know intersex is not without its own controversy. For example, some people don't like intersex because it has the word sex, which makes people think of sex acts. And so they wish there was a different umbrella term. But the point is that the terminology is evolving, and I'm going to be using intersex as the umbrella term, until a better term is introduced. In the broad definition, I know others are going to be talking more about that in your conference. I just want to highlight the four major categories I think that belong in a personhood. One is the biology and anatomy of intersex. One is the very rich categories of personhood. Intersex stigma, I believe, is important to focus on, and also the efforts to resist that stigma. Whether using a narrow or a broad definition, there's a minimum commonality in congenital physical sex. So now I'm going to turn to how the physical sex path actually takes place. This could be a subject for an entire college course, but I think I'm going to highlight at a high level some of the key concepts I think that are important to master. Number one, it's important for precision to begin to distinguish between what is physical sex, what is gender, what is sex expression. Not to say one is more important than the other, or that they don't overlap, but just to keep separate, because a lot of errors happen in medical situations because there's a conflation of different terms, and so the point A makes the point distinguish. Make sure you're talking about what you're talking about, and in particular, intersex has a physical basis in sex development components. These include sperm, egg, chromosomes, genes, gonads, hormones, and anatomy in turtle and ex-turtle. These components are related to fertility, but that doesn't mean that they develop in every male or female and culminate in fertility. Speaking of fertility, some intersex individuals are fertile and others are not. Sex development is marked by sequential phases. The first is very fast. It's called sex determination. It happens around fertility. And it's called determination because basically what's determined is that this is an entity that has human character. It's heading in the direction of human, not a tree or not a turtle. It's determined. Some things have happened to determine. It does not mean that everything is a light switch and by any means, and that is determined. No, in the second phase, which lasts much longer, from conception around fertility to puberty, in other words, years, there's an interactive sequential process, hormones affecting anatomy, and this keeps going and going. And so it's very possible that things happen anywhere along the way that make for a different sex development than male or female. I wanted to highlight some key qualities in sex development. We just talked about sequential processes. So again, sex determination precedes sex differentiation, but within sex differentiation, there are many sequential processes. Number two, bipotential tissue. This means that in the human fetus, there's tissue that, depending upon the hormones and the sequential processes, it can go either male, female, or intersex. So what happens is that, for example, in a male, an XY, so we think of male, there's some processes early on in the cell division in which hormones are triggered that suppress the female and grow the male. Similarly, in the late stage, which is when the external genitalia is developed, that tissue has the bipotential potency to be able to go female or male. And depending upon testosterone hormone all along the way, it can go from female all the way to male or be interrupted, somewhere along the line. So it's important to think of sequential processes and bipotential tissue. So I hope I've given you a flavor that, given the complexity of sex development with multiple components, by the way, intersex can happen in any one of those components, an intersex trait. So the complexity of sex development with multiple components, sequential phases, and hormonal production and reception at just the right time, intersex traits aren't uncommon. In fact, at 2% of the population, we're talking 160 million people across the planet. Intersex is an umbrella term for over 40 types. Intersex is not one type. So we can look at causes. One way to look at this is causes. We can talk about chromosomal causes or deficiency or mutation in hormone production or reception or in enzymes. We can also talk about sex gene mutations. We can talk about environmental causes such as prescription meds. There are unknown types. We just don't know all that there is to know. And furthermore, don't assume that an intersex person, if they tell you they're intersex, know all of the aspects of their intersex. It can be very expensive and invasive to know a complete diagnosis of all traits if an intersex person, in an intersex individual. I was so overwhelmed in the beginning when I knew I was dedicated to this area and I was trying to sort through the terms. I finally hit on some concepts that helped me begin to organize the information in my brain. So it would help me to know that intersex traits can be in any of the sex development parts in an individual. It also helped me to think of testosterone as powerful, that if there's too much of it in an XX or female, then that can masculinize the XX baby, or if there's too little of it in an XY baby, that can feminize it. Also, you can also look at intersex development traits as visible from the lens of extra, missing, or mixed. So I just put a couple of the categories of the sex components up here. So in chromosomes, we can look at extra. So people are born, Klinefelters will have XXY and other possible configurations. Turners at X0. Mixed, some individuals actually have XX and XY in one body. So of course, with all of this diversity, 40 different types of intersex, there's going to be a lot of different sub-communities or perspective, people that share a perspective, not rising to the level of sub-community, but perspectives about things. So there are subgroups that support individually some of the intersex variations. Time of discovery can be create very different social experiences. Imagine if you are diagnosed at your birth and you have had a lot of medicalization all along your life versus you don't even hear until you're 13 or 14 because you went in to find out why you didn't have a period, and all of a sudden you discover an intersex variation. That's a very different first 13 years of life. There is a big difference between those who've been surgically altered and those who have not. There's a difference in partner preferences. Some individuals are some individuals are heterosexual and others do not identify as heterosexual. There's a very big difference between those who consider their intersex as a condition or a defect and those who consider their variation as natural and that it should be affirmed, beautiful as born. There are a lot of different identities that individuals have related to their sexuality. We'll take a look at some of those in the next slide and a couple of the trans intersex identities. So this slide, I put 3 possibilities, but there's so many different possibilities just to give you an idea of some of the diversity. You may have an individual who says, my physical sex is intersex, my gender is man or woman, and my partner preference is heterosexual. You can have an individual say that their physical sex is intersex, their gender is intersex, and their partner preference is anything. Or you can have somebody who say, I'm a male or a female, and I'm a man or a woman. And again, partner preference can be any variation. So a lot of diversity in how people identify with a variation in sex development. People ask frequently, is this the same thing as trans? And there's overlap. It's not the same thing. The major difference is the difference between an intersex body versus a trans body, which I'm having to speak in generalities here, but generally speaking, a trans body is an endosex body. So classic male or classic female. So how does an intersex trans situation happen? I'll give you an example of the 2 that I'm most familiar with. The standard practice is to assign all babies male, female, male boy or female girl. A lot of times doctors will make a mistake. The child later grows up to feel that was not as accurate as the quote unquote opposite sex. So that physician mistake will ultimately create a situation where the adult individual wants to transition. Another situation that I've seen more than once is that adults reach maturity and they realize that they really feel like they need a different hormone than what they've been getting. And when they take the other hormone, their body starts to change, and all of a sudden it becomes unsafe, for example, to go through an airport line and have your passport say one thing and your body looks a different way. So for safety reasons, not because they were unhappy with how they had been assigned male or female, boy, girl, but for physical safety reasons. So I did a little chart to just show you some of the difference between endosex and intersex trans. So endosex trans, the physical body is male or female. Intersex trans, the body is intersex. Access to surgeries. Endosex trans, because their bodies are considered normal, male or female, they consider them that often they have low access to surgeries that they want as adults. Intersex individuals often frequently feel that they had too many surgeries as infant that they didn't want. In terms of adult health access, I don't think that anyone would say that adult access is great, whether you're trans or intersex, but at least there have been some trans clinics that trans endosex individuals can go to, and intersex individuals will frequently try to receive treatment at trans clinics. But the problem is that the hormone therapy that frequently goes along with health, even if not leading to transition, has been normed on male or female bodies in order to serve endosex trans. So what the point I'm trying to make here is that healthcare can be so difficult for an intersex individual to find access to because their bodies require different tweaking. No intersex body is exactly the same. And so an ideal treatment would be where the physician says 1 week, how does this feel? Let's tweak it a little bit more. Let's tweak it a little bit less. But that becomes acting out of the protocol that was established according to male or female bodies. And that puts the physician outside of the protections, the malpractice protections, if he's at practicing outside of the standard of care. That's just one example to say that intersex individuals have very low adult health care. Intersex individuals are born into the social context in which, as we mentioned before, heteronormativity stigmatizes. And then as a result of the stigma, intersex individuals experience shame and isolation. Heteronormativity has certain qualities. It's pervasive. It's the operant approach in many environments, including maybe many or most medical practices. It has a should quality. It's normative. You should be this way, which creates fear of religious, social, or political rejection. And then there are penalties if you fall outside of the boundaries. It uses circular reasoning to erase the other. So in the case of intersex, since heteronormativity, physical sex is all there is, therefore let's erase intersex through infant surgeries. Reminder again, an intersex person can have a heteronormative viewpoint. But bottom line is that there are too many factual exceptions for heteronormativity to serve as a scientifically factual paradigm. Just to give you two examples, women born with AIS actually have XY chromosomes and they're born with testes. So how does heteronormativity handle that absolutely factual situation? How does heteronormativity handle the situation saying go into the bathrooms with either your XX or your XY chromosomes when there are multiple chromosomes? So heteronormativity does not explain what there is in life. My research showed a particularly heinous form of heteronormative stigma in that I heard words like annihilation and erasure, monstrosity, and it became clear to me that intersex people were told that they do not even exist. How does that non-existence, how is that communicated socially? First of all, by definition, only in a heteronormative world, only male or female bodies exist and the other is a defect. By surgeries and hormones to erase the individual, or by avoidance or denial to avoid a stigmatizing diagnosis. You may hear, I'm not intersex because my genitalia is not intersex. I'm not intersex anymore because surgeries fixed me, so now I'm male or female. Or my hormone levels are normal. Or my gender and chromosomes match XY, boy, XX, girl. It also happens by eugenics, fetus abortion after genetic testing. This is not because of the expense, it's not common, but we're in a changing time and we don't know if more is to come. There are medical protocols, however, that are now seeking to affirm intersex individuals as non-pathologized, beautiful beings, not in need of surgical alteration. I refer you to Boston Children's Hospital, the Center for Young Women's Health, and their work on MRKH. Originally, they assumed that all MRKH women needed vaginal enlargement. And so vaginoplasty was an automatic recommendation. Now they do not assume that all women want a vagina. They affirm the individual as beautiful as born. If the individual only after puberty wants a vaginoplasty or vaginal enlargement, they do not consider the surgery unless dilation of the less invasive procedures of dilation have proved unsuccessful. There are some wonderful individuals that have really done amazing things to fight heteronormativity and then to reach out to others in their struggles. I focused on intersex activists, and when I listened to the stories and piled all of the different emotional themes, I was able to see three patterns. In the first, there was a before pattern in which the activist wasn't, the only knowledge that they had about human sexuality was heteronormative. And they felt confused because their body wasn't behaving in ways that matched heteronormativity. How does a person now assigned girl explain nocturnal emissions at night? So different things were happening in their body that just didn't make sense. And then there was a middle phase where there was the undoing, maybe through medical records, maybe learning about intersex individuals on the website. Somehow there was an undoing and an investigating and a discovery. And by the third phase, the activists had decided heteronormativity theory is not accurate for me. It may work for the majority of people, but it does not work for me. And I don't need to be chasing something that is not accurate. And then they, from the empowered place that they were, they moved into action supporting other people. There were hundreds, literally hundreds of emotional themes I've logged. We've talked about intersex non-existence. I wish I wish I could spend a whole day with you all talking about all the emotional themes, but I just will highlight one more, which was it was really poignant to listen to the different stories in which the individual, before they really challenged heteronormativity, they kept saying, "Am I real? Am I real man? Am I a real woman? Am I a real woman if I don't have a uterus? Am I a real woman if I was born with testes? Am I a real man if I was able to give birth? Am I a real man if I have a micro penis?" So this positioning against heteronormativity as norm caused a lot of soul questioning that was just, am I real? Am I real? Luckily, or happily, that later on was deconstructed and reconstructed into what I called beyond the binary identity. So the Beyond the Binary Identity is a useful guide of intersex emotional themes to train counselors. It's a useful map for guiding clients to possible next growth. Positive is not meant as like a happy face, normative, but rather individuals are living with greater self-approval and less psychological pain. Number 8, I wish we could send a whole college course on intersex personhood, looking at social experiences, cultures, different ethnicities, political actions, spirituality. But there's just a rich personhood once we raise our head up above what we're being told shouldn't be and look at really what is. One of the histories that is worth taking a look at is how the U.S. developed the protocol in the beginning to begin to surgically alter intersex infants and youth. It's wonderfully portrayed, poignantly portrayed in John Colapinto's book, As Nature Made Him, The Boy Who Was Raised as a Girl. I really refer you to that book. In conclusion, there are so many benefits of training lay audience. I look for the day of more affirming counselors, intersex adolescent and adult training, and one day the golden rings, self-determination by the intersex persons themselves, freedom from optional sex-related surgeries in infancy and youth, individually tailored adult health care, and legal protections. Have a great conference. Talk to you in a minute, hopefully live.